Dear students, in continuation with the last lecture, today we are to discuss the various disorders related to the male reproductive system, that is the human male reproductive system. Disorders. There are so many disorders at any age of life, but the important ones are, number one is called Adam. Adam. Adam stands for androgen deficiency in aging males, in aging males. You know, androgens are the male sex hormones. Male sex hormones. Like we mentioned it earlier also, that is testosterone is the main androgen. With increasing age, after the age of 60, the level of the testosterone decreases in the body. That is, the production of the testosterone decreases. It is estimated that between the age 60 to 69 years, 20% testosterone decreases up to 20%, and after the age of 80 it is 50%. It has been estimated. This is age related, androgen deficiency in aging males. It means sex desire decreases. There is no proper erection of the penis, that is the male copulatory organ. It can occur at any age. It is not specific as it is the female menopause, and it is therefore also called male menopause. Male menopause. Testosterone level decreases. Adam, that is androgen deficiency in aging males, and this is also called the male menopause. The male sex hormones, that is the testosterone, that level decreases with age, and therefore libido, that is the sex drive and sex desire, decreases. Now we come to number two. Number two is impotency. Impotency. It is the inability of the penis, inability of penis to remain erect till the completion of the sexual intercourse, till the completion of the coitus. Inability of penis to remain erect till the completion of coitus. And this impotency can occur at any age. Now, one thing more I would like to tell you, that this impotency, or it is the Adam, especially Adam, in impotency also, there is discovery of a wonder drug that is very much available in the market, that is known as Viagra. Viagra. This Viagra contains sildenafil citrate. This drug contains sildenafil citrate. Sildenafil citrate. This is Viagra. This is a wonder drug. This drug has been discovered by 3 US scientists. US scientists. They are Robert Foshcott and second the scientist, that is Farid Morat, and the third scientist is Louis Ignarro. This is the number 1 scientist, second, third. And these scientists collectively got the Nobel Prize in Medicine in 1998, Nobel Prize. In 1998, very important question, or not in the form that it is very important at the +2 level, but it is just for your knowledge that these scientists, they got the Nobel Prize in 1998 for the discovery of the drug Viagra. Number 3 is called BPH, or let us say prostate hypertrophy. Prostate hypertrophy. Prostate hypertrophy means it is the enlargement of the prostate gland with age. Now we know prostate is a very large sex gland and it is present below the urinary bladder, around the prostatic urethra. When its size increases, it means its weight increases. Therefore, it compresses urination, or it compresses the urethra. Enlargement of prostate gland compresses urethra, causing night urination. Night urination, frequent night urination, which is called nocturia, or it can be a painful urination. Enlargement of the prostate gland that compresses the urethra, causing night urination or painful urination. The night urination is called nocturia. Now this hypertrophy or enlargement of the prostate gland, it can be benign, which is this, benign, not malignant, or it can be malignant. Then if it is malignant, it is very common cause of cancer in case of the males, in case of men. Then this malignancy that enters the other organs of the body also, that is called metastasis. 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 One thing more for your knowledge that I tell you, there is one protein which is called PSA. Prostate specific antigen. Prostate specific antigen. When the level of this PSA increases to much more extent in the blood, then cancer is suspected. Not only by PSA, but also the weight of the prostate gland. Normal weight of the prostate gland is 18 grams. This is for your knowledge. This prostate hypertrophy, enlargement of the prostate gland, then nocturia, prostate specific antigen, it can be malignant, we call it prostate cancer, or it can be benign, and it is in the old age, mainly after 70 years of age. After 70 years of age. Fourth is inguinal hernia. It is the protrusion of part of intestine into the scrotum, through inguinal canal, intestine, a part of the intestine that gets protruded, that enters the scrotum through the inguinal canal. It means it gets dislocated. And now we come to the fifth part, that is called hydrocele. I mentioned it earlier also. When a lot of fluid, large amount of fluid gets collected, fluid is collected in the tunica vaginalis layer of the testis. Tunica vaginalis. You know, tunica vaginalis, that is, outer is called the parietal and inner is called the visceral. A small amount of fluid is already there, but when a large amount of fluid gets collected in the tunica vaginalis, then there is swelling of the testis, and that swelling is known as the hydrocele. Now we come to the next point. Now we come to point 6. In this case, there are some terms related to disorders, that is aspermia, then azoospermia, then oligospermia or oligozoospermia, then comes asthenozoospermia or zoospermia, then comes tertozoospermia. Or oligozoospermia. Aspermia means no semen production. Semen is not produced. No semen production. Azoospermia. Semen is produced, but there is no sperm in the semen. No sperm in semen. Oligospermia or oligozoospermia means low sperm count. It can be below 25 millions of sperms per ml of the semen. It means there is low sperm count. That is called oligospermia or oligozoospermia. Asthenozoospermia. Sperm motility decreased. Tertozoospermia, abnormal morphology of the sperm. Sperm has abnormal morphology. What is the normal morphology of the sperm? We discussed it, that a sperm has proper head, tail, head, neck, middle piece and tail. Out of all these, one is absent, or the sperm is not having tail or head or middle piece. Anything can happen. So it is aspermia, no sperm production, no semen production. Azoospermia, no sperm in the semen. And oligospermia, low sperm count. Then asthenozoospermia, sperm motility decreased. And tertozoospermia means abnormal morphology of the sperm. Seventh point is cryptorchidism. I told you that during 7th month of pregnancy, the testes descend into the scrotum. It means the testes are extra-abdominal. When the testes do not descend into the scrotum. Why? Due to low production of testosterone in the embryonic stage. Because under the influence of testosterone, these testes descend into the scrotum. Then by surgery, because if they will remain in the abdomen, no sperm production. We know sperms are not produced at body temperature, and it will lead to infertility, or we can say sterility. So this is done with the help of this surgery. We use the word orchiopexy. This is the surgical procedure, orchiopexy. Students, we have already talked about the castration, that is removal of the testes surgically to calm down the animal. It is mainly in case of animals, to decrease the aggressiveness of the animal so that it could be domesticated. Castration. Surgical removal of testes, and this surgical procedure is called orchiodectomy, or it is also called orchioectomy. This orchiodectomy is done, that is one and the same thing, these two words. This is castration to decrease aggressiveness of the animal. It could be domesticated, So that's all, and thank you very much.